3 years ago, Attigo, part of the Mednet Group, began to launch a community mental health project in Ghana. So this is a bespoke service for Ghana, providing healthcare professionals a programme to give patients and carers the tools they need to manage their own severe mental health conditions. Since the programme has launched, we have recruited 118 patients and received some fantastic feedback from healthcare professionals, patients and carers.
Yes, it can. In the sense that already we have seen the project making a lot of difference to some of the participants of this project. Like we had mentioned earlier on, people are getting empowered about their illness conditions. They are asking the right questions, and I'm sure they are equipping themselves with the necessary knowledge to be able to achieve full recovery and able to sort of pursue the full potential of their lives. So I think it's already making a difference, and the hope is that it will make a bigger difference when it's rolled out nationwide.
Certainly, the fact that we have people actively making inputs into their care, we have people being part of the decision making, they feel important, they feel cared for. At least there's been a change in perception from carers' side, from the service user, and even the healthcare personnel who are conducting this research have had a change of perception in terms of outcomes for persons with mental illness. And one unique thing I find about this project is the fact that we don't brush aside spirituality, and we also emphasize recovery, which is cultural to us in terms of being overly religious people and attributing mental illnesses to spiritual causes. This is a golden opportunity for people to embrace the medical model in spite of their faith or belief system, and making them aware that it's not bad to have a belief in a higher force, but it's also good to embrace the medical model for a better outcome.
This program will go a long way to address some of our challenges. It won't obviously solve everything, but it will address a lot. For instance, if you have a service, which we have, which is largely largely institution-based, centralized, it means that you are not seeing as many as you want to see in the communities. And that means a lot of resources are spent within the psychiatric hospitals, freeing very little to the community. Now, this program will help to reverse the situation where you'll see more patients in the community and less in the psychiatric hospitals. That will free more resources to be spent in the community. That will help reduce the stigma and discrimination. That will boost up confidence in people. That will improve access to care because you are seeing them in the comfort of their homes. So it will go a long way to address some of the challenges that we have.
What we did in terms of looking at the solution for the technology for mental health in Ghana was to talk to the staff, we talked to the patients, we talked to the carers, and we talked to the IT staff as well within Pantang Hospital. And then we developed it with them, what their needs were, and we were very conscious of the fact that we were looking at a community-based model. So what we needed to do is make sure that anything that we developed worked remotely, worked in the community, and was live. Technology will benefit the wider population within Ghana because what we've done is we've developed it on a mobile application. Much of Ghana is remote. Much of the African continent, people live within the communities that are remote. So what this does is it leapfrogs a lot of existing technologies to make it remote, to make it bespoke, and it can be used anywhere within the country. And we feel this is a huge, huge benefit.
for carers, most of their money is a problem. The program is helping them because I guess a few medications, some of the medications are expensive. Most of the times they have to make trips to the hospital to see nurses. Now nurses are coming to you. Sometimes you have to always make time to be with a client at home. Now the client is being taught, client is living better. So most carers cannot even leave client at home and go and work. So it's helping them save time, it's helping them make more money, and it's also helping them to understand the client because now they know what is happening. They know what is happening with the client, they know how to manage the client. So when they see alarming signs that the client is kind of relapsing, they easily pick it up and then they report it. But initially, no, they used to not pick anything because they don't even understand the client. Some used to even tell the client that they are possessed. But now, things are going better. They are understanding the clients better. Life is easier for them. Most of them are giving positive testimonies. I said they have been able to work. They don't think so much about their children because the children are doing well on their own now. So it's helping the carers also.
Currently, I'm handling about 3 cases. We just started not long ago, but I'm handling about 3. I can remember very well from my last visit, one service user was quite enthusiastic that we are doing this, that we are coming to see them in their homes. He categorically mentioned that he's not had such visits in a long time. In Ghana, we have community mental health care, but their services are not this broad. They do not offer much services as Atigo project is offering. So he said categorically that he's happy that he's getting calls. People are calling him to find out how he's doing, and also that he's getting medications, and the prompts that he gets, the text messages, which remind him to take medications. And since he joined the project about 2 months ago, he has seen that he's doing very well. He's also happy that nurses get to visit him to enlighten him upon his condition, to understand better what is really wrong with him. Apparently, before, he feels that the mom and the family at large have not been supportive enough. But with the education we had, he understood that he had to take charge of his condition, his mental health issues. As much as the family is supporting, he has to be involved. He has to partake in changing his life around. And he got a lot of knowledge pertaining to what schizophrenia is, because he even thought the cause was spiritual. Yeah, so he got to understand that it's a medical issue that has to be handled from that point of view. So in his respect, he said he would prefer to be seen at home rather than in a hospital. And that if once in a while you have to pass through the hospital, that would be okay. But for him, he'll want me to keep coming and coming and coming. And he even said that he'll wish I come the next week. So I see that this project is going a long way to support people in their environment, to help them come out of the challenges that they face and empower them to take control of their lives. I think all the 3 cases that I've visited so far, they are all saying the same thing. They are happy and they want this to keep going on, because aside all that's going on, they are getting to understand really what's happening to them. They are getting to experience what it means to have care in the community, and then also the advantage of having someone to talk to in this regard. It's quite I'll say good. And this project should be encouraged by our government, by our society, and the institutions at large, so that we try to decentralize care back to the people in the community.